Welcome again to Pitfalls. I am Professor Emma Fallendown.
And Dr. Julius Tipover here to talk to you about the post-fall assessment. Of all the risk factors for falling, the greatest is a prior fall. And the most effective intervention is to understand why the fall occurred, yes? That's why it's critical to conduct an immediate post-fall assessment. You ask how, and we will show you.
Step 1. Determine the history of the fall. Ask the resident about his activity at the time it happened, why he thinks it occurred, and if there were any other associated symptoms such as dizziness, lightheadedness, or loss of balance. If the resident is unable to answer, use your own observations if you witnessed the incident, or use any information from any other eyewitness accounts to draw conclusions about any factors that might have contributed to the fall.
Step 2. We conduct a complete physical exam. This means we record post-fall blood pressure, respiratory rate, and temperature. Check the resident's head for lacerations or bruises. Take the resident's pulse, noting rhythm disturbances. Evaluate the resident for gait steadiness, joint trauma, and leg strength. And conduct a neurologic assessment to determine levels of alertness and cognitive ability. Also, we take blood pressures, both sitting and standing, to evaluate for orthostatic hypertension again.
Step 3. Evaluate the resident's function and behavior. Record any recent changes in walking or balance and whether the resident was using his walker or cane if they have one. Examine any recent changes in his ability to carry out daily activities and continence status. And make special note of any behaviors that may have precipitated the fall, including wandering, agitation, or other forms of restlessness.
Step 4. Re-evaluate the environment in which the fall occurred, looking for any hazards. Note the location of the fall, floor surface, and the type of shoes the resident was wearing.
Step 5. Review the resident's medical history. Identify current and prior conditions that may have contributed to the fall, including medications, current medical problems, and significant changes in lab results within 3 weeks of the fall.
I will tell you that taking this systematic approach, we can help determine possible reasons behind the resident's fall and make changes to significantly reduce his risk for another and potentially more serious incident.
It's one of the best ways to protect the health of those for whom we're caring.
And so, now you have many easy ways to recognize when the risk for falling is high, to help you then use more effective interventions and preventions.
Thanks for listening, so you can make a big difference in helping someone avoid those painful pitfalls.
And they will thank you also. You have our guarantee.